Hello viewers, once again we are on your screens to share with you our amazing, valuable insights on motherhood. This is Mom's Heart Talk Show. You are a very exciting talk show where you are always anticipating to hear from us. Here today we have another very interesting topic to discuss with you. Last week we learned so many things on signs and symptoms of pregnancy. Our very expert guest took us through so many things, the presumptives, the probability, and then the positive signs to show that whether you are pregnant or you are not pregnant. It's a journey, as I said. So we are continuing the journey and we are covering you up so that we don't miss anything in this journey of motherhood. So now you are pregnant. We want to continue with it. When you are pregnant, what happens again? What do you do? How do you take care of yourselves? When do you visit the doctor? We are coming to discuss this today. And we have our guests with us who will do that with us. We'll go for a quick break. When we come back, we'll introduce our guests and our main topic for today. Come back. Today we introduce our topic for today, which is first visits to antenatal, and then our second topic will be the nutrition or the supplement in pregnancy, which is given to pregnant women. So we have our guest here to do the honor with us, in the person of Madam Mary Ejari, our very own experienced midwife and a public health nurse. Madam, please, you are most welcome.
Thank you.
Welcome to Mom's Heart Talk Show. You've been with us from the start of the journey up to this time. We are most grateful. And we are enjoying your excitement, your valuable insights, and then the important explanations we are giving to us on all our topics. I know our moms out there are really learning a lot. And even me sitting here, I'm really learning a lot. Thank you so much for being with us on this journey. So our topic for today, continuing from what we discussed last week. So last week we've discussed that the signs and symptoms, the lifestyle that we need to, the one we need to quit, and then the one we need to improve on it. Then the signs and symptoms with which one can know that I'm pregnant, or is just the presumptive one, or maybe there's a probability, yes. So we want to know down, let's assume the person is pregnant. There is a positive result that the person is pregnant, being scanned or palpation of the tummy. Yes, so we want to know the first visit. When should someone visit the hospital?
The ideal time to visit for antenatal or your first visit should be in the first trimester. So the first trimester, when we talk about first trimester, it means that the 9 months journey, 9 months, has been divided into trimesters. So the first 3 months will be the first trimester, the second 3 months will be the second trimester, and the last 3 months will be the third trimester. So we recommend that within the first 3 months, you should go to antenatal and have yourself checked. So normally between 6 to 12 weeks, because the first 3 months will be the first 12 weeks. So from the 6th to the 12th week, we expect that you go to the antenatal.
So that is immediately after you find out. Yeah.
You find out that you are pregnant, then you have to visit the antenatal. So we call it the booking visit. That's your first time you are visiting the antenatal. And there are a number of things that will be done for you the first time. So the first thing is that we will take history. So we need to know a lot about you. So we are going to take your social history, we are going to take your family history, we are going to take your medical history, your surgical history, then your reproductive history.
So all this will be done on the first day.
On the first day, there are lots of questions that will be asked using the maternal and child health record booklet. So as they ask, as you give the responses, then it will be recorded for you. So we want to ascertain how well you are situated for the pregnancy, and if there are early interventions, then it will be done for you as soon as possible. So that is the history taking. Then we also have measurements. We call it anthropometric measurements that we need to take. So your blood pressure, you would have to take it. We need to know the baseline blood pressure. So your blood pressure when you became pregnant, then we'll compare it as you progress in pregnancy. So that if there is any change, then immediately we intervene for you. So we take your blood pressure. We need to know your weight.
Okay.
As you come, we need to know your weight because we expect that you gain weight as the pregnancy progresses. So the ideal weight that we want to know is between 12 to 15 kilos.
The ideal weight?
Yes, that you should gain during pregnancy. So if
that's during the whole 9 months.
We want you to gain between 12 to 15 kilos more.
Okay.
That's on top of what you weigh when you start the antenatal. So we take your weight, the baseline weight. Then now we will take your height. So we want to know your height because normally we said that how short you are will tell whether you'll be able to give birth yourself. Yes, so we want someone to be at least 150 cm tall or 1.5 meters. So any woman who is below that, for us we think that it will be difficult for her to go through labor by herself because that her height will determine how short her pelvis is. So it means that it's not likely that the baby will be able to pass through the pelvis for her to deliver by herself.
Okay.
So how tall you are also. Yes.
So looking at me, can I give birth?
No, you will be above 1.5.
Really?
Yes.
So my sisters who are short,
yes. So that is why we take them.
So is it just by height to know the size of the baby?
Everything that we do is giving us more information. So the fact that we take your height and it will be you are above 1.5, then at least it gives us a fair knowledge that you'll be able to go through. Of course, there are other risks that may not let you go through, but at least as far as height is concerned, we have settled that.
Okay.
So we take height, but height will be taken once. Because within the period of pregnancy, you will not grow tall. Yeah, so we take your height once. So height will also be taken. Then now we'll take your urine. Because we want to check for protein. We want to check for sugar
in the
urine. So the protein will help us so that if there are issues about preeclampsia or eclampsia, it will show us, and maybe if there are kidney issues, we'll be able to see it.
So when you see the protein, that's what it is.
So the interpretation will tell us that whether you are normal or whether we have to probe further.
Okay.
Then we have to also check for sugar. So the sugar will also be suggestive of diabetes in pregnancy. Pregnancy in itself will affect you when you are already diabetic. And pregnancy will also cause you to have diabetes. So it is this and that. So we want to be sure that you don't have.
Someone can be free of diabetes, but when the person
gets pregnant,
there's a probability of the person
developing diabetes. That's what is termed gestational diabetes. Okay. And so that one too has its own influence on the pregnancy. So we want to be sure that anytime that you come, and that one will be carried out every time that you come for antenatal. That is the blood and sugar and the urine and the blood pressure. So I said, and the weight. So it's only the height that we take it once. Yes. So these are the anthropometric measurements. Then after that, we are now going to do the blood tests. Okay. So all this will be done during your booking visits. So the history taking, the measurements, and your tests. So the tests, we have a number of them that you are supposed to do. So, we are going to take your sickling, because we want to know your sickling status. We want to know your sickling status, because your sickling status and that of your partner will be able to give an idea of what the baby will carry. So we'll take your sickling status. Now
not to cut you off, but I learned the sickling is very important, even for you to do before marriage.
That is what we do. But in our part of the world, there's supposed to be preconception care. We talked about that in our previous episodes. And we said that we need to know your sickling status and that of your partner. But normally, most of our pregnancies are unplanned. And we don't even care about what our partner has and what most of us will not know. So some people, the first time that they know their sickling status
It's
is
during
during pregnancy. That they will know their sickling status.
But it's something ideal that we should check.
You should check. You should know.
You even
So
get pregnant, whether you are married
before you even choose the partner, so that you do not compromise the health of the unborn child. So we will do your sickling. You have to do your hemoglobin. You have to know the level of blood. Your level of blood. You have to know about it. Then you have to do your hepatitis testing. So that one
is also another key
important thing. So you do the hepatitis. Then you have to also do your you have to know your HIV status. So now we used to talk about prevention of mother to child. Now we are talking about elimination. But we want to do away with how mothers are able to transmit HIV to their children through pregnancy.
Okay.
So that ideally everyone should know their HIV status even before becoming pregnant. So that once you are positive, it's not a death sentence. You can be put on drugs so that you will not transfer the HIV to the unborn child.
But the fear is there. I don't know why many fear checking their HIV.
The stigma. Up to now, stigma.
Yeah.
Now, it's...
But when you check it and they break the news to you, it's to yourself, right?
And
we
live in a society. We live in a society. Sometimes your partner will be there. I have witnessed a very funny but sad situation some years back in my practice.
Okay.
This was a lady who was positive. The lady was positive, and the lady didn't want the partner to know that she was positive. And the partner was negative. Yes. So the partner was negative, the lady was positive. And now the partner does not know that the lady is positive. So he thinks that both of them are negative. And now the lady comes for antenatal and the lady is put on drugs. And the lady does not know how to take the drugs because the lady has also pretended that she is negative. Meanwhile, she knows that she is positive.
So she knew the status before getting pregnant?
She knew her status before getting pregnant. But some way, somehow, the guy is negative. And now the lady needs to take the drug so that the lady does not transmit it to the child. And she is now not taking the drugs. For fear of stigma.
The husband will get to know.
Will get to the partner. It wasn't her husband, it was a partner. So the partner will get to know. And now how did you get so I cannot even come close to you and there's going to be issues.
A whole lot of issues.
So the stigma attached to it makes people not come out to test. That's about so but we need to know.
Yeah.
And now syphilis to test and see your syphilis status because the pregnant one with syphilis, you can even pass it on to your unborn child. Your unborn child can be blind later on in life. Yes.
But you don't hear more of syphilis now.
Syphilis is there.
HIV.
Yes, because now syphilis is treated if it's detected early. By no HIV, you have to live with it for the rest of your life. So you have to test about syphilis.
But I know HIV patients or clients who have lived for a long time.
When you adhere to your medications as you should, if you follow the instructions, there are some that even they look so much better than people without. Yes, so you cannot see that this person is HIV just by looking at them. And some too, their CD4 count has gone to very low levels
because of the medication.
So they are
free.
Yes.
Talent is free.
It's free. So by this means we are urging everyone to come out. Just know your status. Know your status. At least
you know you are not doing anything bad. Just check your status.
Know your status.
Okay. You might not know. Sometimes it might not be just through sex, but other means.
Exactly.
Visiting the pedicure, those things. You can just.
So the work that you do might even expose you, and you may not know. So that thought that we had that anyone who is HIV positive has been in a promiscuous lifestyle is a thing of the past. It can be even through blood transfusion. You see, it's not your fault, but probably you were given blood that wasn't properly screened, and now you end up having. So it's possible to get it through that means. And now we have to know your blood grouping. It's very important. So another test that we do is your blood grouping.
Okay.
And because sometimes in the process of pregnancy or delivery or after.
So the blood grouping is which one? Is it the A or the negative or the positive?
Yes. So the blood grouping is known the A, the B, the O, and the AB.
Okay. And the second is?
The second is AA,
okay.
AS, SS or SC.
Okay.
Then the cross matching. When you talk about grouping, normally we say grouping and cross matching. So the cross matching is what will come whether you are O negative, O positive, B negative, B positive, AB positive. Those ones are the cross. And so you can know your blood group that maybe you are AB. So it is the cross matching that will let you know whether you are the positive or the negative type. So we do all that.
But when you are doing that, is it only for the pregnant or invite the partner or the husband also to?
So it depends on. So let's say you take the test, the HIV, and you know that the lady is pregnant. So you can advise her that you didn't get pregnant by yourself. It was with a partner. So let your partner come, so that your partner also know the status. And that's where the issue is. How the woman will be able to break the news to the partner that maybe you are being called, because they know that once it's pregnancy and you're going for antenatal, why do I need to also come?
But shouldn't they come, the men? Even if it's not about the HIV status being positive or not, is it not ideal that they come?
Ideally, once the two people are bringing up a baby,
yes.
So it's better that you go together, whatever they tell. Sometimes even the women become disappointed or they are down when they have to take their medications. But once your partner is there, a supportive partner, can urge you on, they can give you all the emotional support, all the physical support, all the financial support, you see. But in our part of the world, we think that the man is weak when they follow their partners too. And we have a policy. Once you go to the antenatal, if you have a male there, no matter how busy the place is, as long as you came with your partner, we make sure that we visit you or we take care of you first. Okay. So that you'll be able to go
when you come with
your partner. So that one, we want to use that to motivate the. But even with that, we don't get them.
But why are they not coming?
That's why I say that they feel like them. They feel like maybe it's a sign of weakness if you have to follow your wife around to visit. But that is not
this
so.
Is an emergency. You carry your wife.
Yes. But so why don't you go? At least whatever is being said will be addressed to both of you.
Go through the journey of
and you see, yes. You take a scan, then you see that, oh, this is my baby. My baby is doing well. It's so nice.
But some men are doing it.
Some men are doing it, and for those ones, we applaud them. They should continue. Okay. It's not a one-time.
So we encourage you, the men, please continue us to antenatal,
yes.
So that you know the kind of medications we are taking, everything to help and support your women.
Yes.
Okay.
Then the first day, we also make sure that we take a scan. Because as we
so
said,
you take a scan on the first day?
Yes, ideally. We want to take the early scan is good. So that one, we want to take it between the 6 to 12 weeks. And it helps us to know the EDD, which is the estimated date of delivery. The estimated date of delivery. It helps us to know whether the fetus is 1 or is 2. It helps us to know whether the fetus, they will measure the fetus to see whether it is thriving well. Okay. Yes. So normally the first scan is very necessary.
So we do all that on the first.
On the ideally, but you may not be able to. We don't always want everything to be like the hospital. Some attend a health center. Someone may be listening to us. The person may not have the privilege of going to a hospital, probably a health center, and that health center may not have the labs. So they will look at you, then they will give you the labs and say, go and do it in a bigger place. Then the next time that you come, you bring the results. So sometimes it's like that in other places.
So you don't get the results the same.
For some places, you may not get the results. But in bigger facilities, where they have the lab facilities attached, they will be able to get it that day.
we've really learned something this morning. Visiting the hospital for the first time, I didn't even know there is a lot that we have to do. The number of labs and scan and other things, which are very, very important to know at the early stage of our pregnancy. We go for a quick break. When we come back, we'll continue our conversation. Stay with us. Welcome back, viewers. This is Mom's Heart Talk Show, where we celebrate the incredible journey of motherhood and also provide valuable insights for amazing moms out there. If you want to join us on our conversation, just subscribe our YouTube channel, Mom's Heart Talk Show, and then all our social media handles to join the conversation. You can send your contributions and questions, which will be answered to you. We have also on our website, www.momsheartfoundation.com. You can also visit there. We have some of our videos there and also other things which we needed for this motherhood journey. We are selling it, and then when you buy it, it goes directly to the Mom's Heart Foundation for our outreach programs and then orphanage homes to support the needy in this motherhood journey. So we continue our conversation. Madam Mary, the tests, are we done with all?
Yeah, so there's one particular test recently we have to pay attention to. So that's GCSPD.
Okay.
So now, when as part of the test that will be done, GCSPD will also be done. So it's either you are no defects, full defects, or partial defects. The reason why we want to do the GCSPD is that, as in preventing malaria, we give sulfur drugs. So those who are partial defects or full defects of GCSPD, you don't have to give any sulfur drugs to them. So for them, the SP that we give, the full defects and the partial. So for them, the sulfur doesn't permit or the SP that we give during pregnancy, pregnant woman from the 16 weeks upwards, that we give to them, they are not part. So we give them alternative ways of preventing malaria during pregnancy. Okay, so they are not part. So that's also very important.
Does that also affect the
fetus? Yes. So now we've realized that some of the children that are born, you have to check their GCSPD status. Initially, we didn't know about that. So that same sulfur drugs go for them. So once you are full defect or you are partial defect, anything sulfur you don't need to take. At all. So most of our anti-malarials have sulfur in them.
Okay.
So you may see that someone will take the anti-malarials and they will not react, but for others they will take it and they react badly. So we need to know the GCSPD status of whether it's a child or it's an adult, whether it's a male or it's a female.
And very important.
It's very important. Yes.
So that's
yes.
Okay. So we move on with the pregnancy. We know there are a lot of misconceptions, there are a lot of rumors, there are a lot about pregnancy. That's do this, don't do this, do that, don't do that. At least with the first visit, you know about yourself, medically, everything about yourself, taking your history, so you'll be told what things that you have to do. When it comes to nutrition, let's speak nutrition. What to eat, what not to eat. We've heard a lot of things. Don't eat snail, don't eat ripe plantain, don't eat it. For first trimester or through the journey of pregnancy, what foods are ideal for us to eat? Or are there foods that we can't eat?
Okay, so thank you. So normally, pregnancy has a whole lot of issues, as you said.
Okay.
All because previously, we used to associate some conditions with a certain foods that we thought the mothers ate that resulted in that.
Okay.
So we didn't have much scientific basis to explain about cerebral palsy, about autism, and so we thought that these ones were related to some foods. And even because of those same reasons, it was said that when you are pregnant, hide the pregnancy. So you see that your tummy starts to show before you now visit the antenatal. And because when people start seeing, there will be some people with evil eyes, and they will now cause, the child will come and the child will have so many defects. But now science have come to prove that there is no relation to that, because whatever happens, which is the autism or the palsy, has their own causes, and it's not linked to what we eat. Now coming back, for pregnancy, we need to eat well nutritious diets. We know that a normal person will eat morning, afternoon, evening. But for pregnancy, once you become pregnant, because of the growing fetus, we require that there is an extra meal. You have to take an extra meal. Now, they say we should not say we are eating for two. Yes, but we have to eat well for two. We should not say, but we have to eat well so that the growing fetus will get enough nutrition to grow. It's not about the quantity, but it's about the quality of food that you are eating. So when you check the new maternal and child health report book, the page 17, we have a 4-star diet. So we tell the mothers that make sure that the food that you are eating comes from the 4-star. So it's made up of 4. So the 4-star, every food that you eat has to have the 4 stars. So we have the legumes and cereals that will make 1 star. Then you have the animal protein. That also, yes, the animal protein will be the meat, the eggs, the fish. Those ones will also make. Then then the legumes. The legumes will be the rare, the granules, the agushi, the sesame seeds. All these ones make up the legumes and cereals. Then we now have the fruits and vegetables. So we are talking about the tubers. So the tubers will be our cassavas and our yams and our rice. Yes. Then we have the fruits and vegetables. You have the animal protein. Then you have the legumes and cereals. So we make sure that the food that you are eating comes from these ones. So let's take
the plate of food should have
all these 4 within. So a typical example is you are eating rice balls and groundnut soup. So the rice ball, the rice comes from the 1 star, because the rice will come from the tubers or the energy giving. Then the meat that you use to prepare will come from the animal protein. That's also another star. Then now you have the granules that you use to prepare the groundnut soup. So that one too will come from 1 star. Then you have 3. Then obviously once you are preparing the groundnut soup, you will use tomatoes. So these are the vegetables. The tomatoes that you use to prepare, or the onions that you use to prepare, all these ones, the pepper, all those ones will also come from 1 star. So that food, at a sitting, you have the 4-star diet. So we should not focus on maybe any foreign diets. Our local foods, when you plan your food well, you are able to get your fufu and light soup will also contain the same, because the cassava will also come from the same category as the rice. Then your soup and your animal protein, they all come. So at the end of the day, you realize that you have the food within the 4 stars. Then the others that will also help will be the fats and oils. So those ones are not really part of the star, but once they are in the food, they enhance the food. So we also have those ones. But our fruits and vegetables are our problem. The food we can eat. Someone will say that now the cravings. So I like kenke with fish and pepper. You have, but because you don't have vegetables attached, now you are lacking, or fruits, you are lacking in 1 star. So we try as much as possible so that we will get our fruits and vegetables. That's the natural and the raw. I'm not talking about the drinks. Let's say the fruit juices, but I'm talking about the fresh foods, maybe a smoothie or something, so that you're able to get all the nutritional aspects within the one food that you eat.
But the cravings, is there something that we can do about it?
You know, some people's own are so severe that, especially during the first trimester, some experience, and I know another time we are going to discuss about the pregnancy cravings. So it becomes so severe that they are not even able to keep food down. Wow. Especially during the first trimester, their nausea and vomiting is so severe that anything that they get within, then it comes out. So that one, we advise that you take food in bits.
Okay.
You don't take one and you are able to identify foods that cause the nausea. So you try to do away with it. And you try to take dry foods and take it in bits.
Then would that affect our first diet?
It will. That's what I'm saying. Once you take it in bits, so you may not get the 4-star diet within one meal. But at the end of the day, you'd have been able to take the foods from the 4-star diet, but you have taken it in bits. Because some will say that I can take amamu. But when you add any other thing to it, I cannot take it to come out.
Who will be taking one particular food ever since I saw the person being pregnant?
It's going to affect the fetus.
And they complain that's the only thing they can eat.
Yes, but you need, now us, we are not going to eat for appetite, but you are going to make a conscious effort that.
So that's why we say we eat for two.
You have to make a conscious effort that whatever you are taking, we are not really taking for taste, but we are taking because of the fetus within us. That's we are trying to support the growth.
So even the cravings and then we should be able to manage.
You have to be able to
control
manage
the cravings
more. And earlier on, I talked about gaining weight. So if you gain less weight, it's going to affect the fetus because the fetus will not gain the required weight within pregnancy. So at the time that the fetus will go, either the baby will be small for days. So the baby will come out. The ideal weight at birth will be like 2.5 to 4. So this baby will come and will be less than 2.5.
So is it the mother that couldn't eat well?
So there are a number of conditions. So the diet is one major factor. So when you eat well, you're able to gain adequate weight within pregnancy. But the eating well too, once you eat too much, you're also going to gain excessive weight. And the baby may become too big that you cannot deliver by yourself. So you may end up in cesarean section. So we want to balance.
So we have to be in between.
In between.
But so some mothers, I think this one is a very interesting topic for our mothers out there, because when it comes to nutrition or eating habits during pregnancy, it changes from your normal eating habits.
Yes.
And then with this particular craving that I'm talking about, you see, a mother may not adequately or the balance of food to eat well for the first trimester. So I can say that maybe first trimester, that's why I'm having the cravings. It's a mama I'm eating. For the 3 months, it's a mama. Maybe when I get to the second trimester, I'll balance it. Is it possible?
Yeah, you see, the first 3 months, the baby is developing rapidly.
Okay.
That's where all the organs are forming. So the heart, the brain, the liver, and so you don't want to take chances. If you want
for the
first 3 months, so we are very particular even about the medication that you take. For the first 3 months, everything is serious business. The baby is forming. It is the blood clots that it is coming together to form the baby. So now that every part is forming, it needs a lot of nutrients to form well. It wants the baby to form well. That's why some babies can come and then they have hole in hearts. Because at the time that the heart was forming, there were issues, so the heart could not form properly, and so it left a defect.
Okay.
You see, the other months the baby will be forming all right, but the organs in itself will start developing from the first. So any defect they may correct on the journey, or they may be like that, and then the mother will deliver with that defect. So it's serious business. The first 3 months or the first trimester is serious business.
With everything that we take in.
Yes, everything that you're taking. So when you're even taking a medication, you should not self-medicate, because you may not know whether what I'm taking, whether it is good for me or it is not good for me.
Some mothers share their drugs, their medication.
Yes. So someone will go and say that, oh, I'm not able to attend. And someone will just go to the pharmacy and just go and list medications that they think that they want to take. No, it doesn't work that way.
So let's talk in terms of sleeping. Because as you are saying, the first 3 months, how the baby is forming. I learned pregnant women have a way of sleeping. Should it start from the first 3 months, or that's when the tummy is big?
So, habits are difficult to change. So, probably you are someone who likes sleeping on your tummy, and that is the most comfortable position you can get. What the other way for all of a sudden, something is growing. You see that you are having a protruding belly, and so you are supposed to change the position, and yet easy. So sometimes, before you fall deeply asleep, you may assume the side position. But by the time you wake up, you realize that you've gone back to the other positions because that is what you find comfortable. It's not easy. Sometimes it becomes very uncomfortable, but you have to lie on your side for some time. Then you lie on your side. You have to change it for some time, but you should not go face flat. You should not go face
from
flat.
The first.
As you get used to it, as it's growing, then you are okay. So that you don't, by way of habit, you don't turn. Some people sleep on their tummy.
The reason why I'm asking that question is I heard a story where the mother gave birth to a child with the hand not really formed well, and they said the way she lied on one particular side during the pregnancy, so that side couldn't really develop well because there was no movement or any other thing because she was lying on one particular side. So that's why I'm asking.
So what they said can be true and cannot be true.
Cannot be true.
Yes,
okay.
Because the baby is moving. Some babies are in the abdomen and they have their heads up and their bottom down. Some too will move and their head comes down and their bottom comes up. So as to whether now when you lie down, is the baby's side that was damaged is what you lied on. Because the baby is moving.
Okay.
It even gets to a point that the baby is lying like this in your tummy. That is the transverse. So the head will be here, and now the legs are here. So at that point, let's say if you are lying on your left, you are not lying on the baby's arm now. That's what I'm saying.
You are lying on the head.
You are lying on the head. So it can be true or it cannot be true. Then the other thing too has to do with the forming, the baby forming. So probably that defect was there even before the mother delivered, and it had nothing to do with the sleeping position. So it can also be true that at the time when the baby was lying, forming, and the baby was at the side, the mother's just slept on. It can be true or it cannot be true. So we don't rule it out entirely, but we cannot say it is true.
Okay. But is there a way to find out?
Yes. So normally, from 16 to 22 weeks, we have something that we call anomaly scan. So that anomaly scan, it is going to be done solely to detect whether the baby has abnormalities. So that scan is different from the normal scan that you take. It takes time.
But then it's very good.
Yes.
So at what stage of the pregnancy is it?
So no, it's the second trimester. So and it's a short window period. So between 16 to 22 weeks, you have to take the anomaly scan. If you don't take it, it cannot be done earlier, it cannot be done later.
Oh, okay.
Yes.
So if you miss that,
that is all. Wow. That anomaly scan, if you miss it, that is all. Yes, it is that time that you are able to check. Detect everything from head to toe. They are going to take their time to check head to toe whether the baby has issues whilst in utero. So if you are not able to, you miss that window period, then it means that any other thing, you can't do anything about it. So at that point, if there are issues, it
can be corrected.
Not corrected, but it will be seen.
It will be seen.
So if it can be corrected, fine, that one you get to know. But if it cannot, then you get to know.
You know what is coming.
You know what is coming.
Wow, there is a lot. We want to talk about our final subtopic on the supplements. So you mentioned that when you go, so you are done with your test, you do scan and everything, we are giving medications. What kind of supplements are we giving?
Okay. we want to support pregnancy. We want to support, so we all want an optimal end. So we are trying to support the pregnancy. So what we give is folic acid. But ideally, folic acid should have been taken before pregnancy.
Yes, I think in our previous episode
we talked about it before pregnancy, and even up to the first trimester. That's when folic acid is much needed. But this is a case we don't even report early, and so we are using the folic acid to support. It helps in the development of the fetus. It helps to prevent neural. We have something called neural tube defects. I've seen a baby that was born, and the spinal cord, there was no skin around some portions, so you could see. Yes, that's part of neural tube defects. You could see that there's a hole at the back. Yes, it's a neural tube defect. So folic acid helps to prevent that. So it's supposed to be given and taken. Now the giving will be given, but the taking is a problem because we feel that I'm not sick, so why should I be taking medications all the time? So we give folic acid. Then because pregnancy in itself reduces your blood volume or the blood level, so we give the fesolates.
Okay.
Then that one is given so that you'll be able to boost that, because some people may start pregnancy with an age of, let's say, 12. And the funny part is that if you take 10 pregnant women, 5 of them, they're already anemic even before they started the pregnancy.
Okay.
So you can imagine that if you don't support them with fesolates, by the time they get to the second trimester, third trimester, the HB would have dropped further. Well, it's not in the pregnancy that they're going to increase the HB. Rather, pregnancy is even going to bring the HB down. So we want to support it with the fesolates. So that's why we give the fesolates. So the two main supplements that are given are the folic acid and the fesolates. But for some, they complain that they cannot eat, and so we add multivitamin to it. Okay. Then along the way, we add calcium so that it will help in the development of bones. Then when we get to second trimester, then we give the awareness. So that we'll be able to clear everywhere.
Then the awareness, so first trimester?
No. You don't have to take the awareness. You have to take it from the second trimester and third trimester.
So we should stick to the medications
that have been given you
for the first trimester.
Then I also want to hit on, some will say that I'm taking, let's say, expensive ones, pregnant care, and all that we want to tell you is that it is not about how expensive the medication you take is. You know, some have added nutrients. It helps to build, but most of these can be found in the diets.
Okay.
Yes. So if you cannot afford and you are giving folic acid and fesolates, and that is what you can afford, it is also good. Go ahead and take it. It's not the one who took the pregnant care that will result in a very healthy baby. It is how you adhere to the advice that you were given, how you eat healthily, how you're able to take care of yourself, avoiding what we tell you to avoid. That is what will result in a healthy baby. So don't beat yourself up, and you have to, your partner, you have to go and worry your partner, buy me pregnant care, what does and that, and the others that. Because it does not mean that it's always result in a healthy baby. It is about you, and it is about how you take care of yourself.
Viewers, we go for a quick break. When we come back, we'll run out on our episode today. We'll have our last question for Madam Midwife on the foods that we need to avoid during the first trimester. So we've learned that there are so many drugs you don't even take it at all. It should be under the supervision of a doctor or a midwife being given to you to take it. Go for a quick break. When we come back, we'll wrap up the show. Welcome back, Mom's Heart Talk Show, where love begins and healing never ends. So, Madam Mary, our last question, then we wrap up with our show today. We've had a very interesting discussion on so many things, and we are so much grateful unto you. But we want to find out, when you were talking about the medications, there are medications we need to avoid, and some that's good for us. When it comes to nutrition, you've really explained the 4-star diet, but is there any other foods that we should avoid during our first trimester.
Okay, thank you. So there are caffeinated foods and carbonated drinks. These ones we should not go near them in our first trimester. So what we want to do more will be the leafy vegetables and our wholes and our legumes, just as we have talked about. And so we try as much as possible so that we do not take much salt, a lot of salt or foods that are very salty. That's why I said that it is very tricky, because some will talk about this is what now I want to eat. This is what I can, when I take down, it stays. So that's all that I want to take, because you've talked about having food within. And so this is the only food that I'll be able to take down. But in as much as you take it, we also talk about moderation. Make sure when you are eating, you make sure you eat everything in moderation. Then there will be a time
caffeine foods
we should avoid them.
From the energy
coffee, energy drink. Don't even go near them. When you are in the first trimester, don't go near those ones. Then the ones that may not be too bad, but we don't want you to take more of them. It will be like our salty foods, the sausages now. The sausages, now junk foods are springing up. That is what you feel like eating, but you don't.
That makes our husbands and partners travel all the way
to go and bring
those in the middle of the night.
So you have to control yourself for the sake of your baby. Try and control yourself. And there are some to that are not nutritive at all. Wow, you know there are no nutrients, so don't waste your time on it. Sand and one soap soap there are so many. I say control yourself.
Wow.
The hormones are working, but try and control yourself.
Wow.
Because we say that after all that suffering, if you are not able to get a healthy baby, then you have suffered in vain.
Yes.
And so all that we are saying is that make sure that what you are taking into your body, now that you say we eat for two, whatever you are taking into your body is not for you per se, but because of the baby that is growing up.
Your last words.
So pregnancy is a journey. And it's a mystery, because what is within you don't know. So your role will be that whatever that you are bringing out at the end of pregnancy, make sure that you play a very good role so that you don't have regrets. If you are asked to take your medications, make sure you take them. If you are asked to avoid certain things, for that, if you are a heavy drinker, someone said that pregnant women should never drink alcohol. But you say that, let me just take. No, at the end of the period, whatever comes out is what you contributed to. So make sure that you are proud of the baby that you bring out.